I'm Janet Mbogwa and I'm here in Nairobi. The case for change has finally made its way to Kenya. In Kenya, 40% of people still can't afford to seek treatment from hospitals when they need it. And it's those who need it most, like mothers and their young children, who most often have to choose between putting food on the table and paying for healthcare. But thanks to an initiative set up by Safaricom in partnership with CarePay and Farm Access, this is starting to change for good. The creation of mobile accounts like M-Tiba and M-Pesa have given millions of Kenyans the power to take control of their finances and ensure they have the money to pay for healthcare when they need it most. I'm now on my way to Irene's home. She's one of the many residents of Kawangware who have benefited. A little bit about Kawangware. It's a semi-permanent living area, otherwise known as an informal settlement or a slum. A lot of the residents that live here, most of them live below on less than $5 a day. And so they can't really access healthcare. It's just not affordable for them, and therefore they don't plan for it. We've arrived at Irene's home. Habari. Mwambie Tony atoe tabasamu kidogo. A smile kidogo. Na unapata matatizo gani kulea mtoto bila babake?
Unajua vitu zingi inakuwa changamoto kubwa juu sahi sifanyi kazi, mamangu ndo anani provide. Shida mingi kama nguo, kama ni sabuni, chakula, inakuwa changamoto sana kutafuta.
Alafu ulijuaje kuhusu M-Tiba?
Nilitembelea Bondaki, alafu wakani register M-Tiba, nikaendelea kutumia sasa.
M-Tiba ilikusaidiaje wakati ulikuwa mjamzito?
Ilinisaidia sana juu ilinisaidia kusave a little kama 100. Nikienda clinic mpaka nikaenda kudeliver, nikaenda kuzaa, nikaregister John kwa M-Tiba, naendelea na clinic naendelea umlipia na M-Tiba.
So uliweza kusave, ndio sasa ulitumia hizo pesa wakati ulikuwa unamzaa?
Kwa natumia M-Tiba kulipa clinic katika ujauzito. Inanisaidia sana juu nikitumia M-Tiba inakuanga more secure juu hata naweza lipia M-Tiba nikiwa hapa alafu niende hospitali.
I have brought my case for change right here to the CarePay offices in Nairobi, and this is a case that I've really fallen in love with because it's going around the world and it's changing lives, right, and capturing the people who are doing it.
In 2015, Safaricom and Farm Access came together and decided to leverage on the mobile technology based on how M-Pesa had driven financial inclusion, to use the same technology to drive access to healthcare. Since M-Tiba was launched, they have seen more and more women, especially women with small children, coming to their clinics because they are able to save small bits. Previously, those women would not be able to have the money because unfortunately in some cases the husbands would take the money and go drinking. So the impact we're seeing is that the vulnerable people in the communities, especially women and children and the elderly, are able to actually access healthcare.
What are some of the challenges that you saw before with regards to not having access to a platform like M-Tiba?
Most people are not able to access healthcare, have money, because they don't have money. So what happens is that illnesses go untreated, symptoms worsen, and because of that, they have to sell their family belongings, or they are not even able to get healthcare, and unfortunately in some cases they die. Most of the women and elderly in low-income places are shy away from going to the hospitals because they'll be turned away on account of not having money. So by having a tool where these people can actually start planning and saving for their healthcare needs, the hospitals also started viewing these people differently.
How are you getting technology in the hands of these Kenyans? Some people might say, but what if they can't afford the technology? So how do you address that?
So you'll be surprised, Janet, that in this country, people have a very high affinity for mobile technology. As you know, about 25 million users are actually on Safaricom using their mobile phone. So, and this is a very simple technology. It doesn't cost anything as long as you have a mobile phone.
I'm still in Kawangware, finding out about the benefits of M-Tiba to the residents here. And one of them is Grace. I'm about to meet her at her salon. Na nani alikuambia kuhusu M-Tiba?
Mimi niliendanga hiyo hospitali ya Bodaki, nikakutana na Susan, akanielezea about M-Tiba na nikaona ikiwa mzuri sana, akaniregister.
Na kabla ulikuwa umeregister kwa M-Tiba, ulikuwa unatumia nini? Tena kwa mambo ya matibabu.
Nilikuwa tunaenda nikiwa tuna pesa.
Alafu pesa tu zilikuwa zinaisha hivyo, si ndio?
Sasa vile nimeingia ni M-Tiba, naona inanisaidia sana. Hata kama ni clinic na nikipeleka mtu natumianga tu M-Tiba. Ni mzuri sana, anaweza kaa tu saa zingine kama ana pesa, ana kitu yenye anaweza jisaidia nayo, lakini akiingia M-Tiba anaweza jisaidia sana akianza kusave, yani inaweza ikafanya nikampromote sana.
Okay. This story shows that it's not always the most innovative piece of technology that changes lives, it's the most innovative use of that technology. And by liking, sharing, and commenting on this video, you can help transform even more lives. Don't forget to subscribe to our channel to help us make a case for change.